your organization has value. There is value embedded in the organization, either in your data or your network or your access to patients or the wisdom that is accrued in that organization over a long period of time. Oftentimes it's a matter of leveraging that value, identifying that value, and in our world trying to figure out who actually makes money because of what you're doing or who actually saves money as a result of what you're doing. And then it's oftentimes partnering with early stage social enterprises who are good partners for patient-centered groups that are represented here. And oftentimes it's partnering with nonprofit service delivery organizations who bring something that complements the value embedded in the organizations that are represented here. And then actually approaching the marketplace to find those organizations who are benefiting from what you're doing financially, putting the business case together and then approaching them, which is oftentimes a complicated message because for many organizations that are represented here, they're being funded through another third source, right? Whether that's philanthropy or individual donors or grants. And meanwhile, we're trying to approach this new player saying, hey, you should buy my service directly. Hard message. Oftentimes when we find ourselves in that situation, a pay-for-success model or a social impact bond can be a great way around that. The realities are there's a lot of impact capital out there. There are very few transactions. So we live in a time when there's more capital than there are transactions. And for this audience, the message is nice and simple, which is the time is now. These are not for the faint of heart. These are actually very difficult to pull together. But then again, the payoffs are pretty significant from a financial perspective and from an operational perspective. Actually doing the hard work of making the transactions and the interventions and the programs be more efficient to take access and to gain access to this impact capital, those exercises are all worthwhile and beneficial to the members that are represented here. Social impact bonds are a mechanism to scale what works, right? So if there's a service provider doing something and has some good data behind it that says, yep, in general, it produces this outcome when it tries, and that program or that intervention actually saves a third party money, right? Or whether that's a Medicaid MCO or whether that's a hospital network or whether that's a state government agency. Modeling all that out and then allowing a third-party investor, an impact investor, to actually invest in that program or that service to then save that third-party money. If and when that third party saves money, they would share in those savings back to the investor. An element that is very common across all of our clients is straight up courage, right? This is not work for the faint of heart. The answers are not obvious on day one. It's a journey to figure out, and I will tell you for across all our clients, every project that we started on day one is materially different on day 60. But going through that process of really trying to figure out what value we have, to whom it benefits, modeling that all out, attracting the investor, attracting that payer, and putting that multi-party transaction together is work that is joyful and fun and new and hard. So my message to the members of NHC that are gathered here is, if this smells like an arena that might be beneficial to your organization, don't think that you're going to have the answer on day one. None of us do. We've been wrong every single time, meaning what we thought the project was going to be on day one, by the time we hit day 60 or day 90, we've learned a lot and we've moved in a different direction. But it's just being committed to that journey to get to the end zone that seems to make these successful.